This is Jeff Breedlove with the Georgia Council on Substance Abuse. On Giving Tuesday, this very special Giving Tuesday, America responds to the COVID-19 crisis in support of nonprofits around America, and we are proud and privileged to be one of those nonprofits on this very special day. And we're highlighting the different programs that the Georgia Council on Substance Abuse, under the leadership of Executive Director Neil Campbell, that we've put in to be of service to the peer recovery community across the state of Georgia. And one of those programs is our program up at Northeast Georgia Medical Center with the Northeast Georgia Community Connections program. It's led by two outstanding recovery leaders, and we have one of them with us today, one of our team leaders on that group of folks on the front lines up there, Ashley Stevens. Ashley, thanks for being here today.
Thanks for having me, Jeff.
So you're up in Gainesville, and the program we want to talk about for this segment is the great and transformational work being done in the emergency department by our peer team. Tell the viewers a little bit about that program.
So Northeast Georgia Community Connections, the ED Peer Support Program went live November 6th of 2017. So we're working up to our third year of being in service with the Northeast Georgia Health System. We are partnered with the Northeast Georgia Health System and also with Laurelwood Behavioral Health, which is based in the hospital there in Gainesville. Anytime that someone presents themselves to the emergency room or is a patient on the medical floor and Laurelwood gets involved, after Laurelwood has identified that individual as having challenges, or struggles with drugs or alcohol, they will reach out to a peer recovery coach. And then that is the point to where we step in and we offer support.
That sounds like
support.
Ashley, that sounds amazing. But I think more than just amazing, because what you're really telling us is that we have a situation now where peer recovery coaches, peers in recovery from substance use disorder, have been welcomed in to the emergency situation by doctors, by nurses, by hospital administrators to work, in essence, alongside them for our disease, substance use disorder. That's transformational.
Absolutely, it is. We have a lot of champions, a lot of big cheerleaders within the Northeast Georgia Health System that really support what we do and support the work we do. They support the lived experience that we bring to the table and that we have to offer to support these individuals. They're really great. They've been really great to us.
And I know that a lot of times when think about recovery, a lot of it's, like what I do, advocacy, and it's theoretical and it may not happen right away. But what you do and the team up in Gainesville do, you're dealing with real human beings in real time, in a real emergency situation. And I would make the case for you, you're saving lives. Tell us some of those situations that you can share with us so that our viewers understand what that's really like.
I mean, it's very emotional at times. We see people, they come in and a lot of times they're in crises. They don't know what to do. They know they want to do something better. They want to do something different with their life, but they just don't know which way to turn. So for us, it's been an amazing thing and an amazing opportunity to be able to sit with these people. And we don't have a time limit on how long we can be in there with people. We just sit with them and listen to what they have to say and support them the best that we can, and we've had a lot of great outcomes from that. I have individuals, peers that I've met with in the hospital, and our relationship has grown to a point to where it's almost like I don't even have to reach out to them. They will reach out to me to ask how I'm doing and just to let me know that they're doing good and that they hope that I'm doing well. And I mean, we make some really, really, really great connections, and we see people in the hospital, and so essentially the way that it goes is anytime that we meet someone in the hospital, we try to follow up with that person within the first 10 days of meeting them, if it's possible. A lot of times people will go in inpatient, so we won't be able to reach them, but we will get in touch with them as soon as we can. And then after that first 10 days, we will follow up once again at 30 days, 60 days, and 90 days. That's kind of like our set standard. But I can tell you from my experience, we follow up with people all sorts of times in between, and for as long as they'll have us, really. We'll keep connecting with people. I've seen peers in the hospital, and 2 years ago, and I still talk to them to this day occasionally. And an individual just a few weeks back that I followed up with him, and he said, "Oh, when I saw that it was you, I had to look at my I Am Sober app on my phone." So he had downloaded an app to keep up with where he was at in his recovery. And, he was proud to say that he was, I can't remember the exact, how long it was, but, he had a few months in, and like, he was doing really good, and he was really proud of himself. So it's really a life-changing thing.
Ashley, I get emotional listening to you share those stories, because again, a lot of people get, they watch the news channel of their choice, and they see these things that are happening in New York and places around the world, and then they hear these numbers. They're constantly bombarded with numbers, but these aren't numbers. This is in New York or around the world. It's right here in Georgia. These are real people. And this is a real difference being made in their lives.
Absolutely.
It's tremendous work that y'all do. I've had the privilege of being in the hospital, going through the emergency room, but I've never had the honor to do what you do. But I know just by visiting the setting and being able to visualize the place that you're at, I know that you're saving lives. The other team members are saving lives. I know that as a peer, when I was in crisis, I wish that I had a peer as opposed to just a doctor or just a nurse or just a police officer. Right,
absolutely. And I think that's a real important piece that we bring to the whole thing is, we have that experience. You've been there, we've done that, and we get it. We're not we're not a doctor, and we're not a nurse, and we're not a clinician walking in and trying to tell you, what you need to do or how you need to do it. Really, we want to sit there and we want to hear what you have to say and see what you think about your situation and how you think that you can get started on your recovery journey, because given the fact that we all have that lived experience, we're all individuals that are in recovery, the coaches, we know what worked best for us, but we don't necessarily know what works best for everyone. We can throw out ideas and suggestions, but we're not going to try to tell you what you need to do or what you have to do. Really, it comes from that self-directed, care and all that stuff. So.
And that's part of what's transformational about this program. Of course, the leadership of Neil Campbell, the executive director of the Georgia Council on Substance Abuse, putting together a strong team with some great co-leads, Ashley Stevens being one of the co-team leaders up in Gainesville. We're so thankful to our partners at Northeast Georgia Medical Center, Northeast Georgia Community Connections, all the local officials up there and businesses and the whole community that's embraced this program across Northeast Georgia. It's just a tremendous example of how the Georgia Council on Substance Abuse is working in partnership across the state of Georgia to lift up the Georgia recovery community and save lives. And on this Giving Tuesday, this very special Giving Tuesday, where we come together during COVID-19, this is when we need your support now more than ever. This is the type of program that your generous gift supports and continues to make possible. Maybe you can't give anything right now, and that's okay. Maybe you can give $1. Maybe you can give more. Whatever you give, every amount matters. It makes a difference. It's a blessing to us. You can website. It's on our social media. It's not hard to find out how to donate. If you're watching this video, it's on our social media. So we were just thankful for your support. Ashley, I want to thank you and all the teammates at the Gainesville, our Gainesville office. That's what it is. Right there on the front lines. Thank you each for what you do, and thanks for being with us today.
Thank you, Jeff.
Thank you. And as we always say, recovery is real.
That it is. Absolutely. Thank you.